Treatment of the breast carcinoma. The basic principle in the treatment of the carcinoma of the breast, we have two basic principles. Either to reduce the chance of local recurrence, one, to reduce the chance of local recurrence. Second, to reduce the chance of this metastatic spread. يعني أما نمنع local recurrence يعني نشيل البريست أو نشيل جزء من البريست to prevent the local recurrence واحد. والثاني we try to reduce distant metastasis. The aim of the treatment in early breast cancer is stage 1 and 2, the T1N0M0 or T2N1M0, and these two stages of the breast carcinoma, which we call them the early breast cancer. Our aim is first to cure the local recurrence or to let the recurrence, either to prevent the local recurrence or to delay the local recurrence. Second, to control the local disease in the breast and the axilla, and to treat the breast carcinoma in the breast itself and to treat the lymph node in the axilla. This is local regional control of the disease. Third, conservation of the local form and function may be our aim in certain type of the carcinoma of the breast, which involve one sector of the breast, not a central type of the breast carcinoma. Sometimes we remove part of the breast, one quadrant of the breast, not all the breast. In this type of the surgery, our aim is to conserve the form شكل البريست and the function حتى يعني يبقى اللاكتيشن المريضة تقدر بعدين ورا سنتين من العملية تقدر ترضع طفلها. For treatment or delay the distal metastasis, either to treat distal metastasis يعني مثلا المريض عنده skeletal metastasis نسوي له local radiotherapy or pathological fracture نسوي له surgery to fix the fracture. This is a treatment of the distal metastasis, or to delay the distal metastasis by giving chemotherapy to delay this distal metastasis. Then the aim of the treatment of the early breast cancer, which is stage 1 and stage 2, هو T1N0M0, T2N1N0, to cure or delay the recurrence. To cure or to delay the recurrence, either to cure the recurrence يعني ما نخلي يصير recurrence, local recurrence, or to delay the recurrence. We delay the recurrence. Second, to control local regional disease. Local regional control of the disease and the control of the disease in the breast and the axilla, or to conserve the function and form شكله and وظيفته in the breast in certain type of breast cancer, or to treat the distal metastasis مثل bone metastasis نسوي له fixation مثل pathological fracture بالneck of the femur نسوي له osteomore, or to delay this metastasis by giving the chemotherapy. These are two important points should be well known to you. Treatment of the breast cancer, basic principle and the aim. Basic principle 2, reduce chance of local recurrence or reduce chance of distal metastasis, and the aim to cure late recurrence or to control local regional control for disease, or to conserve local form and function, or to treat or delay the distal metastasis. Now, to ensure this goal, this aim, how you ensure this aim? Either by doing wide local excision اللي هو quadrantectomy, quartz operation اللي هي مختصر طبعا الكيو يعني quadrantectomy with axillary clearance and radiotherapy. Quartz operation يعني هذا we will preserve in this the function and form of the breast. Second, to do mastectomy with or without radiotherapy, followed by reconstructive treatment of the site of the surgery by implant or by flap. Third, both can be combined with auxiliary surgery, either auxiliary sentinel lymph node biopsy or auxiliary sampling or auxiliary clearance. And then to ensure the aim, our aim in the early breast cancer, 4 aim we have in the early breast cancer, we can ensure this goal by either wide local excision or by mastectomy with or without radiotherapy. Both can be combined with axillary surgery, which may be sentinel lymph node biopsy or axillary sampling or axillary clearance. The 4th point regarding the aim of the treatment in early breast cancer is to treat the risk of systemic disease. How we prevent the risk of systemic disease? By giving the chemotherapy for those patients with premenopausal ER/PR negative. يعني إذا مريضة عمرها 45 أو 40 سنة وعندها CA breast ER/PR negative وعندها liver secondaries, we will go to give to them chemotherapy CMF regime اللي هو cyclophosphamide methotrexate and 5-fluorouracil. هذا regime used for the CA breast. or hormonal therapy إذا كان المريضة ER/PR positive وهي post menopausal عمرها مثلا 60 سنة و ER/PR positive estrogen receptor progesterone receptor positive, they will give to them tamoxifen or Nolvadex. or إذا patient ER/PR negative وعندها HER2 positive, we will go to them to give them Herceptin because they are positive epithelial growth factor and liable for local recurrence. لهذا نعطيهم Herceptin. D, if we have distant metastasis, we can give local radiotherapy for the skeletal distal metastasis and for the flap of mastectomy. يعني مريضة عندها pathological fracture in the vertebra, we can give to them local radiotherapy, or we can give local radiotherapy for the flap of the mastectomy to prevent the local recurrence. What are the indications of mastectomy in the carcinoma of the breast? If we have a large tumor in relation to the size of the breast, يعني tumor is large والبريست صغيرة, فما نقدر نسوي لهم local excision, فنروح نسوي لهم whole mastectomy, نشيل كل البريست. Second, if you have a tumor in the center of the breast, in the nipple and areola, هنا ما نقدر preserve the nipple and areola, إذا function and form of the breast cannot be preserved, إذا ماكو indication for local. There is this indication to do a total mastectomy. If the patient have lobular carcinoma, because in the lobular carcinoma we have multivocality and multicentricity, ما نقدر بس نشيل quadrant of the breast, نشيل كل البريست. 4, if we have a local recurrence after conservative breast surgery, يعني مريض سوينا له quadrantectomy شلنا بس الماس ما شلنا البريست وصار بي local recurrence, هنا indication for doing total mastectomy. or the patient preference, المريضة تقول أنا شيل البريست أحسن ما أنا يومي أتبادل يومي رايح جاي, because I prefer to do mastectomy rather than to do local excision which need close follow-up. إذن 5 indication for mastectomy. What are the type of the mastectomy? We have the Halsted, which is the oldest one, and extended Halsted, which involve the removing all the breast with the axilla, or the lymph node from the axilla, and even the pectoral fascia and pectoral muscle, and even the internal thoracic group of lymph node. Patty operation, هنا modified radical mastectomy with axillary clearance, hold the breast, areolar nipple, and the fat and lymph node and the axilla removed in the patty. If we preserve the pectoral minor muscle, we not incise the origin of this muscle to remove the apical group of lymph node from the axilla. We just explore the area by retracting the pectoral minor muscle. This is called the Wells operation. Conservative breast cancer surgery mean just we excise the mass, not remove the whole the breast. The aim is to preserve the form and the function of the breast without changing the survival rate. يعني هذا ما راح يغير ال survival rate. المريضة اللي عندها malignancy 5-year survival or 10-year survival will not be changed if we go to do local excision for the carcinoma. يعني in total مو أحسن من local بالحالة. We will go to do what's called the quartz operation. What about the axillary surgery? It is to treat the axilla and to stage the disease, which is important for the prognosis of the disease. We have either sentinel lymph node biopsy, قلنا نشيل الليمف نود ده اللي هو يسموه الليمف نود الحارس الأكزيلا. This sentinel lymph node can be identified by injection of the technetium-99 in the subdermal plexus. Then we use the gamma camera to identify the first lymph node that take the technetium-99, and this lymph node will be excised and sent for histopathology. راح نعرف this lymph node either involved or not. If it is involved, we will go to do axillary surgery. If not involved, we will not go to do axillary surgery. Axillary sample يعني ما راح ناخذ one lymph node from the axilla haphazardly and send for histopathology. If the lymph node was positive, we will go to do axillary clearance. Third one هو axillary clearance completely by removal of the level of the lymph node from the axilla and the level 1 or level 2 or level 3. Level 3 معناه removal all the lymph nodes from the axilla. حكينا على sentinel lymph node, how to identify this by gamma camera or using technetium-99 or by using the methylene blue injection in the subdermal plexus. Radiotherapy for breast cancer. Indication of radiotherapy in breast cancer for the flap of the skin after mastectomy in case of the large tumor, large number of lymph nodes, and extensive lymphovascular invasion, and those with HER2 positive. And then should indication of radiotherapy in a breast cancer, first of all, for the breast flap after mastectomy. إذا كان التومر large, إذا كان if you have a large number of the lymph node in the axilla positive with malignancy, or if the histopathology proved that the tumor have a very extensive lymphovascular invasion, or if the patient has HER2 positive معناه local recurrence is high, هذا نسوي لهم radiotherapy for the flap. Second, combined with the conservative breast surgery in part of the quartz operation. بنشيل بس الماس from the breast ما نسوي total mastectomy. هنا نعطي radiotherapy for the breast to prevent local recurrence. Third indication for radiotherapy for local pathological fracture due to bone or skeletal metastasis in the carcinoma of the breast, we use radiotherapy. Four indication for radiotherapy as a palliative treatment for the advanced breast cancer. Adjuvant treatment of the breast carcinoma, either chemotherapy or hormonal therapy or Herceptin. الثلاثة يعتبر adjuvant therapy. Hormonal therapy عندنا tamoxifen that compete with the estrogen and the estrogen receptor, and this will ensure decrease in the local recurrence in about 25%, decrease in the mortality in about 17%, and decrease risk of a tumor in the contralateral breast also. And then why we use the hormone therapy? We use the hormone therapy to decrease the local recurrence and to decrease the mortality rate, and also to decrease risk of the developing tumor in the other breast. ال LHRH agonist هو الانسترازول اللي حاليا يستخدم هواية بديل للتاموكسفين. Also important as reversible ovarian suppression and used in the perimenopausal period patient with ER positive. يعني those with young age group with ER positive, estrogen receptor positive, نعطيهم ما نعطيهم تاموكسفين، نعطيهم انسترازول. Anastrazole, hormonal therapy in perimenopausal patient. Chemotherapy in breast carcinoma, either cyclophosphamide or methotrexate or fluorouracil. Indication of the chemotherapy in perimenopausal patient with poor prognosis. يعني المريضة عمرها خلينا نقول 35 أو 40 سنة وعندها CA breast وعندها نود lymph node positive وعندها ER PR negative. الهرمونات negative والlymph node positive. يعني عندها positive lymph node in the axilla involved by the tumor والER PR negative مالتهم. هذا اكو indication to give to them chemotherapy. Postmenopausal with poor prognosis with node positive will ER also negative. Both of them node positive with ER negative. Also with HER2 positive, this is an indication to give to them chemotherapy. Also the other indication for the chemotherapy in breast carcinoma هو استخدام chemotherapy before surgery. يعني مريضة تجينا عندها فد large mass in the breast proved by true cut biopsy or by pharyngeal aspiration cytology to be malignant. أنا ايش راح نسوي لهم؟ نعطيهم chemotherapy قبل العملية to decrease the size of the tumor. يعني إذا قللنا size معناه قللنا الستيج to down staging of the tumor. يعني نحولها من stage 2 إلى stage 1. هذا down staging يسموه new adjuvant therapy. إذا what you mean by new adjuvant therapy? mean large breast tumor we give chemotherapy to decrease the size then under stage disease. Then we go to do surgery. إذا كان large mass يمكن السيرجري يصير difficult يعني يصير excision of wide area from the breast of the side of the breast, difficult to close this by the skin. فلهذا نعطيهم كيموثيرابي قبل العملية يسموه نيو adjuvant therapy. هذا ماستكتومي with axillary clearance with axillary dissection كلش clear. Post-operative complication of mastectomy may be seroma, مكان العملية يصير collection of the lymph and fluid يسموه seroma, or axillary vein thrombosis or injury during surgery, or edema of the arm, lymphedema of the arm, or necrosis of the skin لأن راح يسوي flap upper and lower flap, or shoulder stiffness المريضة ما تقدر تحرك كتفها, or wounding of the scapula due to injury to the long thoracic nerve of the pelvis during surgery, or anesthesia over the medial part of the arm and the axilla, or weakness of the abduction and internal rotation of the shoulder joint. These are 7 complications after mastectomy. This is a patient with edema of the arm. Quartz operation مثل ما قلت لكم quadrantectomy, axillary dissection of the level 1 and level 2, and radiotherapy to the breast. هذا quartz operation. Breast implant. Implant is a submuscular plane. Its implant in the submuscular plane is a better whenever the muscle is not removed during surgery. إذا المصل باقي بالchest wall طبعا عادة باقي المصل ما نشيل المصل ولا الفاشية نقدر نخلي implant submuscular. If the muscle is removed بالradical mastectomy then we subcutaneous implant is placed. الإمبلانت هو عبارة عن سيليكون. Complication of breast implant, pain, exposure of the implant and rupture, displacement, extrusion يعني يطلع من مكان الامبلانت or infection or capsular contraction. Type of the implant واضح هنا بالصور. Type of the implant with silicone. And thank you.